Now that our everyday life is slowly returning to how it was pre-pandemic, we can never be too sure that our safety is at 100%, especially because the overall health situation in our country continues to be concerning. Earlier this year, a rare infectious disease called monkeypox surfaced, and we confirmed the first case of it here in the Philippines last July 2022. To lessen our worry and increase our knowledge of the disease, join me together with our invited guest, whose expertise lies in what we will be discussing today. I am Dwayne, and you are watching Lifeline, where we improve our lives by feeding our minds. All right. With me here today is our guest, who is an infectious disease specialist, Dr. Maria Rhona Bergantin. So, good morning, Doc. Thank you so much for being here with us today.
Good morning, Dwayne.
Is our mic okay? All right.
I think so.
Thank you so much, Doc. So, today we'll be discussing monkeypox and COVID-19. So, first, Doc, monkeypox. What is it?
Okay, so monkeypox is one of those. I heard you earlier on mention that this is a new disease which surfaced, but actually this has been present since 1970s. As for human illness, but the very first reported cases was in 1950s. So they called it monkeypox simply because the ones who really had this illness are monkeys. And eventually, they were able to document the first cases in humans in Congo. So this is an illness which is characterized by fever, and then also, of course, you have their skin lesions. And if individuals are not quite familiar with it, or let's say, if let's say individuals would take a look at it, they might even mistake it for chickenpox. But there are, of course, differences in the manifestations as well as the type of lesions that you see in monkeypox.
But it's quite similar to monkeypox.
A bit similar, but again, we have to distinguish that it's different from chickenpox because the virus which causes monkeypox is not related to the virus which causes chickenpox.
All right, Doc. So who is most at risk with monkeypox naman po? Is it the same with chickenpox? I know parang a lot of people say it's mostly children with chickenpox. So what about with monkeypox? Is it the same?
So in the areas where monkeypox is endemic, majority of those who are infected are the ones who are kids, like what you have mentioned, similar with chickenpox. But of course, those individuals who have immunocompromising conditions. So who are they? The ones who have cancer chemotherapy patients, who would have, let's say, intake of steroids, so drugs which reduce the immune system. Those patients who have concomitant acquired immune deficiency syndrome or AIDS, HIV. So they are the ones who are more commonly affected, but it can infect almost everyone because we are immune naive, simply because way back 1978 the world has stopped vaccinating individuals for smallpox, and somehow it has affected the way that the virus has traveled across the world.
So it's different from monkeypox is different from chickenpox and the other diseases, Doc. So when we get it, ano pong dapat gawin natin? What should be the first step taken?
Okay, the very first step that we have to do is, of course, isolate ourselves. So if you are quite uncertain if indeed this is chickenpox or let's say monkeypox, and you develop these skin lesions, then we have to isolate ourselves and inform the health authorities because monkeypox is a reportable illness. And of course, we are going to follow isolation measures in this situation. Unfortunate for us, we still do not have the drug which is being used in developed countries. And of course, we only have to rely on supportive treatment.
All right, Doc. Going back to the topic naman, Doc, of who can be infected, there is a lot of myth and talk around monkeypox that it only affects homosexuals.
Of course, that is probably they are relating that simply because in the recent epidemic, or rather in the recent outbreak, we call it outbreak, which has affected, I think, countries in Europe. The ones who have been affected are the ones who are categorized as men having sex with men. But then we have to correct this, because monkeypox is not solely, or is not really sexually transmitted infection, but this can be transmitted via droplets and of course skin contact. So whatever secretions we have, or the infected individual has, if a naive, or if an immune naive individual gets to get contact with that, then that person can be infected. In fact, reports even say that those in the endemic areas, those who are affected are not the ones who really get to have those sexual contact.
So that's a complete myth, Doc.
Yes.
We should correct that.
Definitely. And I think just to reduce that stigma that is associated with that.
Absolutely. So, Doc, lastly, it can be transmitted through droplets and direct skin contact. So how do we avoid monkeypox?
Okay, so similar with what we do whenever we deal with COVID right now. So definitely we have to wash our hands. We still have to wear a mask, because droplet and contact precautions are similar to what we are doing in COVID-19.
So wear your mask, wash your hands. Do we also do the safe distancing? Do we have to?
Ideally, yes.
Ideally, all right.
Ideally, yes. But we just need to emphasize that compared to monkeypox as well, compared to COVID, this monkeypox is not as bad as it seems with regards to COVID. Because we just need to correct this, simply because people are also panicking when it comes to monkeypox.
So it's not as bad as COVID, but it is something to worry about and keep yourself safe from.
Yes.
Yeah, so thank you so much, Doc, for that, for your valuable insight regarding monkeypox. So, Doc Rhona, we're going to have to proceed to our topic on COVID-19. I'm very confident, and everyone tuning in with us today learned a lot from what we have just discussed. We have more in store for you, so don't go yet, as we are going to talk about COVID-19 and the situation in the country. We'll be right back.
We are savvy. We are more than just content creators. We are storytellers. We tell the Thomasian story. Stories of victories. Stories of inspiration. And the story of unending grace. We are 360. You can be found here, here, and here. We have industry-standard equipment and facilities for hands-on use. These equipment also enable us to service people by producing a myriad of content. We don't just share stories, we engage people. We are professionals who take our craft seriously by transforming crazy into impressive, side by side with our student volunteers. We hone, we cultivate, we are committed to truth and kindled by love. We are the USD Communications Bureau. We are always on the move, always on track, and in full swing. Serving the Thomasian community by creating. Grow and growl with us. We are in full swing. We are the Tiger Media Network.
Allowing voluntary wearing of face masks in outdoor settings.
This is Lifeline. I'm sure marami sa comment section curious on the difference between monkeypox, chickenpox, and other similar diseases. So what are the manifestations po that distinguishes each from each other?
Okay, so definitely they may present with fever. And as I have mentioned earlier on, you may have skin lesions. But the difference lies on the fact that when we talk of monkeypox, the lesions that you have are distinct from that of chickenpox, because in chickenpox you're going to be able to see varying stages of development of lesions in the skin. So how do we categorize that or clarify that? For our audience, kung kunwari nagkaroon ka ng butlig sa isang bahagi ng katawan doon sa chickenpox, iba't ibang klaseng butlig. So may pantal, mayroon nagtutubig, minsan meron na yung parang nagnanana. So iba't ibang klase ng skin lesions. Pero kasi karaniwan when we talk of monkeypox, pare-pareho yung itsura ng lesions na lalabas sa katawan natin. So kung kunwari sa isang side, pantal-pantal, puro pantal lang muna siya.
Alright.
And then pag makikita mo na nagkakaroon na ng pagtutubig, tubig na rin sila lahat-lahat. And then kung kunwari yung time na nagfo-fall off na yung scab niya o yung tinatawag nila na covering nun, sabay-sabay sila. And then monkeypox, unlike chickenpox, is associated with lymphadenopathy. So malaki yung mga kulani na nakikita ng mga pasyente na meron noon.
Alright. What about with smallpox, Doc?
Okay. Honestly, I haven't seen any smallpox because when I was a kid, na-eradicate na siya. But what I know about is yung sa literature, similar yung manifestations or skin lesions ng smallpox with that of the monkeypox.
Alright, Doc. So actually, we had our very first case in the Philippines, sadly July 2022. What is the status naman po today, Doc?
So far, wala pa naman na bago nauulit yung DOH na report, diba? So I think we still have only 4 cases and we're hoping that they're not going to increase in number.
4 cases. Hopefully, yun na. Hopefully, yun na. Doc, meron po tayong question here in the comments asking for home remedies.
Okay, home remedies still supportive. Viral treatment, the patient has to rest, and then drink plenty of fluids. Of course, again, as I have been emphasizing, please isolate yourselves. Do not mingle with individuals until the crust have fallen off and the skin has reepithelialized. Or ibig sabihin, may bagong skin na nabuo doon sa kung saan nandun yung sugat. Kasi during the time na nandun pa yung sugat at hindi pa napapalitan yung balat, nandun pa rin yung pagsashed natin ng virus. So nakakahawa siya during that time.
So it's just rest and plenty of water. They're also asking, Doc, if we have to put any creams on the lesions or whatsoever.
None
at
so
all.
far.
All
None so
right,
far.
Let's see, do we have any more questions? I guess that is all that we could entertain for our topic on monkeypox, Doc. So we'll be hearing more from Dr. Bergantin as we assess the overall COVID-19 situation in the Philippines and find out if our country is ready to get rid of the face masks. So good morning and hello again, everyone. And hello again, Doc. So we will be now tackling COVID-19. To get started, what can you say po about the COVID-19 situation and response in our country?
Okay, so currently we are seeing less numbers of individuals who get admitted in the hospital, and that is one good sign. But of course, in the community, there are still plenty of individuals who get sick. We do get to have lower numbers which are being reported by the DOH, but I think that is an underestimate. Okay, this is not to dampen everyone's happiness that the situation is a bit controlled, but definitely the reason why I'm saying that we still have to be on guard is the numbers that we are seeing only are the ones which are reported simply because a fewer number of individuals get to have their PCRs. Majority of the patients who get sick nowadays, whenever they have symptom, would of course do self antigen at home, and then they do not get to be reported in the barangay level, which actually should be done as a responsible Filipino citizen. So the numbers that we are seeing now definitely are a bit underestimated. But the severity not as bad as what we have been having over the past 2 years.
But Doc, let me ask, are people still dying?
Yes, of course. Definitely, we still get to have patients who get admitted in the ICU. Not as often as what we had in the past, but definitely we still get to have those patients who are, 1, unvaccinated at that. 2, individuals who are immunocompromised. So definitely, these are the ones, as I have mentioned probably earlier on in the monkeypox portion, the ones who really have lower immune system. They do bad. They do worse compared to the ones that we have right now in the community.
But I guess we can say, Doc, that is improvement. Kasi dati po, we had a lot of people talaga. Now it's just these people who don't have the vaccine yet, or those with immunocompromised,
Yes, definitely. So we have mentioned, the vaccine definitely indeed helped a lot because the severity has already been muted compared to what we have in the past.
So the severity has been muted. And recently, our government has told the people that we can get rid of the face mask already. What do you think about that, Doc?
I don't agree.
We do not agree
from
with
an infectious diseases standpoint, definitely we do not agree. One, the pandemic is not yet over.
Yes.
And then we might be giving mixed signals if we're going to do that because I understand that everyone gets to have this burnout using the protocols, strict protocols, which we have been following over the last 2 years. But then, please do not put our guards down because we are seeing the light at the end of the tunnel, but then it's not yet over. We don't want that end of the tunnel being again remote somehow because we don't follow that. Why is it that masks are not yet really should be removed? For one, unlike other countries where it's being done, the healthcare system of the Philippines cannot afford to have many individuals who would get sick. We don't want a repeat of what we have had in the past. Two, the population density in the Philippines is not like what you have in other countries. So their individuals would have more room where they can roam around just on their own. But they're here in the Philippines, every square of an inch, may tao ka na nakikita, di ba?
Yes.
So, mahirap natin sabihin yon. Plus, one of the things that often come out malapit na ba talaga matapos yung pandemic? Not yet, because we really cannot say if again the virus would have mutation. So we're quite happy that the vaccine somehow has controlled that. But then again, we have been mentioning always, the viruses are quite intelligent, and at any time when they do mutate, they may give us something which is worse than what we're having right now.
All right, Doc. So we do not have a definite time on how we can see the end.
Yes.
Or the light at the end of the tunnel.
Yet. Unless the WHO probably tells us. Of course, we have to follow them because they are the ones who are monitoring everything.
But Doc, how do we get there? Aside from wearing our masks and washing our hands, are there anything else that we, as Filipinos, could do para mapabilis naman po ang ating end of the pandemic?
Okay, I think we have to boost up on the vaccinations. Whenever we talk with individuals in the community, some of them still are quite apprehensive in receiving their vaccines. Of course, there are still false or fake news as we have it with regards to vaccine, but I think it has indeed done a lot of good. So if booster dosing can be done, so people keep on asking me how many times we have to get boosted or how frequent it should be. We still do not have the exact frequency, or we still do not have the exact recommendations if we're going to have it annually. But probably similar with what we have had in with regards to the flu or influenza, we may be seeing things like that in the future. So we just need to be a bit more patient about this.
A bit more patient and, ensure yung mask wearing even if it bothers you a little.
Yes. A minor inconvenience will do you a lot of good.
A minor inconvenience can do us a lot of good. Exactly, Doc. So every now and then, there has been a COVID-19 surge. Do you think this mandate of the removing the mask will likely cause another one?
Possibly, yes. Of course, also, if people will be quite complacent in following the protocols, that would add to that.
So definitely will be a factor if ever we do have another surge.
Yeah. Aside from that, people have this false sense of security, probably, that the line of thinking is that the masks are already being asked to be removed from now on, so we can do anything and we can revert back to whatever we were doing pre-pandemic. And that is not the case, definitely.
That is not yet the case.
Yes,
Okay.
that is not yet the case.
We are very hopeful na soon, okay, it will be the case. So do you think naman, Doc, that the unvaccinated individuals will be more encouraged not to get vaccinated, given that the protocols seem to get less strict day by day?
Okay, so even if the protocols are being loosened up a bit right now, vaccine is very, very important. In fact, the mandate of the WHO states that there are two things which they highly prioritize. One is vaccination, because that is a means to prevent the spread of the virus, and by reducing the spread of the virus, it reduces the risk of mutation. So when we don't get vaccinated, we still have this chance of passing on and transmitting the virus, and therefore mutation will always be there. And then the second mandate that the WHO, of course, has is to reduce the mortality.
And here's another question naman po, Doc. For our students at UST, ito, Doc, safe na po ba mag face-to-face classes ang mga estudyante?
Honestly, people go to the mall. Why not have face-to-face? But of course, we have to observe proper protocols.
And I guess since with classes, kasi you are required to see each other almost every day or every few days, so there has to be more protocols inside the classroom.
Yes, for as long as individuals who get inside the classroom are always oriented to the proper protocols and no one breaks or reaches that protocol, then we can do so. Honestly, allow me if I may say this, even in our trainees in the hospital, we keep on telling them, hanggang kailan kayo itatago sa yungib? Paano kayo mabubuhay kung nakapreserve lang kayo doon? Kasi kailangan yung harapin yung katotohanan. And people will not be able to practice those protocols if they're not going to get involved.
Doc. Pero tama nga po, Doc, no? We have cinemas open, we have festivals, concerts happening. Why not mag face-to-face classes, which is much more important for the students?
Yes, definitely.
What about the hotspots, Docs? Metro Manila, the COVID-19 hotspots, how are they now?
Okay, bearing well a bit, because the number of those who get admitted are not that high, but definitely the numbers are still creeping up.
Creeping up.
Yep. So andun pa rin talaga siya. Hospital somehow in these situations, not as much as it was before. The numbers relatively has decreased. But at any time, if there will be a surge, then definitely the numbers can go up.
And of course, Doc, we also have to ask the situation of our health practitioners, our doctors, our nurses. I remember early in the pandemic, marami po talagang, naaapektuhan, those who pass away. How are they today? Our doctors po, kamusta naman sila?
Okay, so far so good. Not as bad as it was before. Of course, we doctors and nurses and our co-frontliners still get infected, but again, not as worse as it was before.
Not as worse as it was, which is good. Thank God, Doc.
And I think not just probably the frontliners, but everyone else, they also get to have infection. Probably in the family, they would tell us, Doc, this is the third time or the fourth time that I've had this kind of illness.
All right. So, can we say that it's become normal, Doc? Since third time, fourth time po nila
A
nakukuha.
way of life?
Yeah.
Probably, yes.
But it's not normal, Doc. I hope it wouldn't be
Of course,
something that our doctors would be used
It's not normal
to.
to get sick. You don't want to get sick, but definitely this is something which is not 100% avoidable. And so at all cost, we have to practice caution in doing so.
Caution, Doc.
Caution.
So aside from the what we know, washing our hands, wearing our mask, is there anything else that we could do?
Have that right frame of mind, and please do not violate protocols.
I know we have had a lot of violators in the past. I remember so many early in the pandemic, partying, throwing gatherings. Hopefully nowadays, wala na po talaga.
Sana.
Sana. Okay. So, I guess that is all the questions that we have for today. And I see our comments are flooding. Thanking Doc for, of course, your insight for today. Let's see if we have any more comments. And okay, so our guests are asking, Doc, if you have anything else to say about the COVID-19 pandemic or the monkeypox pandemic in general.
Okay, so first we go with monkeypox, okay? Please don't be scared with monkeypox, but please do not put our guards down, because definitely it's one of the problem, which is, of course, already affecting different areas in the world. So again, this is a public health concern as far as the WHO is has already mentioned in the past. And we just have to be very cautious about our moves, but of course we still have to enjoy ourselves. Now, with regards to the COVID pandemic, it's still not yet over. Always do our share in mitigating the spread of the virus, and always think of our loved ones, which of course we don't want them to get infected. So probably that's it. Always pray also.
Always pray, coming from Doc right here. So we have come a long way since COVID-19 surfaced in 2020, but the pandemic is just not over yet. We have experienced and continually are experiencing makes the risk always around the corner. But with a simple and collective habit of staying informed, we will not be left in shock of whatever these threats bring upon us. To remind our fellow Thomasians out there, we can use and maximize the Thomasian Online Medical Service and Support System, or THOMEDS, to connect with our doctors and gain access to health services. We're also encouraging everyone to update their THOMEDS tracker daily. I hope you got the proper dosage of information in this episode of Lifeline on what you need to know about monkeypox and COVID-19 with Dr. Maria Rhona Bergantin. So thank you so much, Doc. And for everyone tuning in, thank you for being with here today. I am Dwayne, and this has been Lifeline, where we improve our lives by feeding our minds.